is as head of education for the National Ambulance Service, which essentially means that I'm responsible for the programs, courses, etc. that are run through the National Ambulance Service College, but also for training programs that are delivered in the regions throughout the National Ambulance Service. I enjoy the interaction with my colleagues in the operations environment, and I also really enjoy my interactions with my colleagues within ECAT. ECAT is the Education and Competency Assurance team. I started my interest in pre-hospital care, although it was basically first aid at that time, as a 10-year-old cadet with the Order of Malta way back in the late 60s. In 1980 I joined the Eastern Health Board Ambulance Service, as it was then, as an ambulance attendant stationed in County Wicklow. In the early 90s I became a PHTLS instructor because I had developed some interest in training. And in '96 I became a tutor in the National Ambulance Training School, as it was then, and that more or less continues to the present day. So the National Ambulance Service College provides a wide range of programs, predominantly to staff of the National Ambulance Service, but also to our sister organisations such as An Garda Síochána, the Defence Forces, Fire Services, Coast Guard, etc. The courses range from the obvious type of course such as emergency medical technician training, paramedic training, advanced paramedic training, resuscitation training, etc. We provide courses such as command and control courses such as call taker training or call dispatcher training. We have in the past run some leadership programs. We run solo responder courses, and of course in the areas we also deliver regional training, which consists of clinical practice guideline updates for existing staff members, resuscitation refresher training, familiarisation with new equipment. For example, in the last few years we introduced new handsets and new radio systems. All of the staff had to be trained for that. New ambulances which have new features. With every iteration of the new vehicle, something changes in it, so staff have to be trained on that. So there is probably 20 or 30 core programs that we deliver, and then a range of training initiatives to meet operational needs of the ambulance service. Anybody who comes into the service thinking, I'm going to be driving a vehicle really hard and fast all of the time, is in for a rude awakening. I would suggest that people, if they have any sort of interest at all, become involved with a voluntary organisation. And classically the voluntary organisations are Order of Malta, Red Cross or St. John Ambulance. But even engaging in other voluntary organisations like the Irish Wheelchair Association or any organisation that promotes providing care to patients or to individuals will give a potential candidate a little bit of an understanding of their own motivation and allow them an opportunity to reflect on whether this is the career that they would choose. The introduction of the first structured ambulance training courses in 1967, which consisted initially of 4 weeks training and a week on an ambulance. We now have people who enter training as a paramedic student, and it will take them 5 or 6 years to qualify as an advanced paramedic. We're on the cusp of exploring expansion of the scope of practice for paramedics to include community paramedicine, retrieval paramedicine, etc. So the individual who's coming into the ambulance service today needs to be a person who is going to be able to cope with changes both in terms of their role within the ambulance service, within changes on the demands that they themselves will face in terms of professional development and changes in terms of their understanding of their place within the wider health setting. Do I enjoy the job? Absolutely. Would I recommend it to anybody else? Absolutely. And do I look forward to continuing in the role for another couple of years? Absolutely.